For patients who feel that their breasts are sitting low, or maybe they have too much skin on their breast relative to the breast tissue volume that is underneath the skin, they may say, well, what types of breast lift options are available? A breast lift surgery is really anything that elevates the nipple and areolar position from where it is to a higher position. It also typically involves removing some skin excess to try to create a more harmonious balance between the breast volume that's underneath the skin and the skin envelope that's around it. A breast lift procedure could be something as minimal as something as what's called a crescent lift, where the nipple and areolar complex are just elevated 1 centimeter with a very small incision. The next kind of tier up from that would be what's called a circumareolar lift or a donut lift. The nerd word for breast lift is mastopexy, and that typically involves an incision that goes all the way around the areola, and it concentrically gathers skin towards that areola, thereby reducing the overall skin volume circumferentially around the breast. The next tier up from that would be what's called a vertical breast lift, where there is an incision that goes around the areola and then straight down to narrow the footprint of the bottom of the breast. Lastly, there is what's called a wise pattern breast lift or the anchor scar breast lift, where the incision goes around the areola, straight down and underneath. All of these procedures do leave scars that are permanent, and that's why it's very important to choose a surgeon who takes care in creating quality outcomes by making sure that that scar burden is minimized as much as possible. If we talk about doing a breast lift and candidacy for it, we have to address something called breast ptosis. Breast ptosis is a nerd word for sagging. Basically, somebody who has too much skin on their breast and wants their breast to be a little bit tighter or significantly tighter and a more elevated position on their chest wall is a good candidate for a breast lift. To determine which breast lift procedure would be best for a patient, it's important to get a consultation with a board-certified plastic surgeon. In choosing a board-certified plastic surgeon to perform a breast lift, I would highly recommend getting multiple consultations, making sure that the surgeon that you're meeting is listening to you and also addressing your concerns, and not trying to necessarily sell you on saying, well, if you want a breast lift, you're going to have scars, let's talk you into doing an implant because it's an easier procedure for me to do. It's important to make sure that your surgeon hears you and actually addresses your goals and gives you honest advice. Make sure that your surgeon is certified by the American Board of Plastic Surgery and has admitting privileges in a local hospital where, should there be a complication, although it's uncommon, making sure that that surgeon can be the surgeon who continues to take care of you should you need to go there. A breast lift procedure could last as long as 30 minutes and it can last as long as 3 hours, depending on the type of breast lift procedure that is necessary. Recovery for a breast lift procedure does depend upon the type of breast lift that is performed. Something small like a crescent lift could be something where we tell you just to take 2 weeks of downtime and not doing anything really vigorous. If it's a wise pattern or an anchor scar breast lift where I'm actually rearranging the architecture of the breast, that's something that we would recommend where you take 1 week off from work and plan on not lifting anything heavier than 10 pounds or doing any kind of vigorous exercise where your heart rate gets up above 100 beats per minute for 6 weeks.